It'd be nice if I shared my screen also, right? Awesome. Are you all seeing my screen there? Yep, I'm getting some head nods. Awesome. All righty. Well, happy Friday, everyone. Welcome. I hope the music was able to energize us. I know that Fridays are a bit much to have maybe these longer meetings, but we're here and I appreciate every single one of you that are here. I am also, give me 1 second, make sure we have everything lined up. Awesome. And so welcome to today's Open Blueprint, introduction to the blueprint and just a slight orientation around the blueprint. And before we get started, I want to do a little check-in because this is probably the meeting, fall is technically next week. So maybe put in the chat where you're coming from. I know that we already started that in the chat, but where you're coming from, your place, and as well as what are you looking forward to in the fall? And if for those of you who don't know me, my name is Bianca Mieses. I am the network ambassador of the staff. So I'm pretty sure I think I know everyone on here. But yeah, feel free. We have some people who already started dropping in their information there. But yeah, what are we looking forward to in the fall? And tell us your place where you're coming from. Because as we know, network members are spread out all over this country. So drop it in the chat, please. Jersey girl in the building. My location currently, I am in Atlanta, Georgia. That's where I'm coming to you from the South. I like to say the dirty South usually is what I really like to say. Same, looking forward to some color change. This will be my first fall I get to really experience. So I'm looking forward to that. The pumpkins, the apples, yep. Awesome. We'll continue to share there and I'll get us started to go over our desired outcomes. So today we really want to have a shared understanding of the history of the blueprint, shared understanding of blueprint's lever goals, cross-cutting objectives and action steps, an opportunity for open members and stakeholders to review and upgrade the draft's impact hypothesis, and a shared understanding of the next steps for blueprint workshops. And before we dive deep into the history, I want to take a temp check here. So I would like to know, the first question I'm going to ask, it's a polling question. Let me pull up the poll for you all. I want to know, we would like to know how many systems mapping and blueprint design workshops have you been a part of over the last 2 years? And our second question is, how comfortable are you with describing the overall purpose and plans for the open blueprint? So if you could go ahead, are we seeing the poll? Make sure it's good. Yep, I'm just getting some responses there. Okay, so I have a 0 to 2, I have some 3 to 6. Okay, that's a good number. And we're getting some comfortables, neutrals, okay. A little uncomfortable, and that's okay to be uncomfortable sometimes, right? So hopefully after this and some more workshops, we're able to get you a little more comfortable. Awesome. Do I think I have everyone's responses in? Okay, so as you see here, we have majority have been 3 to 6, some type of design workshop, some type of informational thing about the blueprint. So that is good to know. So this is not completely new for some of you, for most of you, excuse me, that is. And the leading is neutral right now, right? So maybe we know a little bit about the blueprint, maybe we know the goals, but maybe we just need a little bit refresher and understanding. And some of you are comfortable with it, which is good, really, really good to hear. All righty, thank you for participating in that. Oh. Awesome. All right, so I'll take us down memory lane. So as you know, we are a network, and I want to first have a working definition of when I say we. I know that tends to seem tricky, and we is not just staff. We is staff. We is also open members. Okay. So when I say we throughout this presentation, I mean all of us together. So the staff hasn't just been doing this work alone. The network has really been doing this work, and we've been assisting and collaborating and working alongside. So just to clarify, working definition, I say we. So we're attempting, of course, to fundamentally change alter the American healthcare system, right? And we know that networks can do that, being that we share the same vision and values, and everybody understands their role and how the process have changed. So as we all know, open members were committed to building an oral health system that is equitable, affordable, and accessible, and one that produces quality outcomes for everyone across the lifespan. And the system should be collaborative, it should be data-driven, cross-sectoral care, demonstrate cost savings and value, and ultimately improve quality of life for all. So a little bit about the history. So back in 2020, which seems like a very long time ago, right? And if you're like me, these years are a little bit blurred together. After a decade of the network working together, it kind of came to a point to reevaluate, approaching the Oral Health 2020 goals timeline, right? Being that also COVID was a reality, COVID-19 was a reality in this world. It was a good point to reevaluate the national oral health landscape. So open members kind of came together over a series of workshops, which is probably where some of you have began the process of this back in 2020, to map out the national oral health system, to uncover the story of our current oral health system in America. So questions were asked like, how do historical and contemporary factors perpetuate health disparities? What keeps the system from becoming more equitable? And how can we learn from the bright spots identified in the system and unleash these positive forces to create the lasting change needed so that everyone has an equitable chance to be healthy and thrive? And so we named the key forces at work, right? People, trends, institutions, and policies. And we thought how they interact to keep the system behaving as it does. The intent was to understand how the system functions, and identify bright spots and the right impact of leverage, and establish a framework, of course, for collective action to produce equitable, sustainable future. So then we move into 2021. We're creating a blueprint action. So drawing from some of the findings from the mapping and process, as well as expertise and experiences working in community on state levels, national roles, and members identified areas with energy disrupting the status quo. These 5 leverage areas are amplify consumer voices, advance oral health policy, integrate dental and medical, emphasize prevention, and bring care to people. So throughout 2021, there were multiple virtual convenings and work sessions, and open members developed the open blueprint for structural improvement, centered on the previous levers I just mentioned. So the blueprint includes a set of strategic interventions, and each intervention has 4 action steps, each intervention and action steps for each lever that network members undertake at national, state, and local levels to support the process of change. So each lever has 4 interventions, which that means we have 20 interventions that we're working with currently across the board. And so we're still in 2021, right? Open members, we choose these action steps based on their feasibility, overall fit with Open's values, and potential for impact. And then we're in 2022 now, right? So bringing, at the beginning, of March 2022, Blueprint Lever Team leads were identified, they volunteered. Shout out to you all, I'll do that in a second. And they began meeting regularly to amplify equity lens, to apply an equity lens and to craft priority goals within the SMARTY framework, create plans for implementing and measuring intended progress. Also, all the work that the network members had been doing in the last year or two, really starting to prioritize the action steps, right? And then ultimately figure out a plan and a way to carry out the action steps, and how do we get members involved, right? And so at one point it's just them brainstorming, and then it's like, how do we get everyone else on board now to do the rest of this work? So I want to give a little shout out to our lever leads here. You can see the names there, and I will stop sharing my screen. And I always want to say personally, shout out to you all. I've not been a part of every single meeting, but I know that Frances has been there side by side with you all. So I see the calendar invites. So I know how many meetings have been going on, how much work has really been going on in this particular hub. And I mean, I think it's the most exciting hub right now, in my opinion. It's really pushing the work forward. And so thank you again for your time and commitment to doing this work. And I will come off screen. I will stop sharing here. And if you all could just do a little wave or a little thumbs up, whoever you are. Thank you, thank you, thank you.
Seeing a lot of off-camera lever leads.
Yep. Awesome. And I will now hand it over to Frances.
Okay, hey everybody. Glad to see you all. And I'm gonna go ahead and share my screen. And there we go. Does everyone see my slides? Yeah, cool. Okay, so the open blueprint lever teams that consist of all of the lever leads you saw on the slide before you. As Bianca mentioned, this year they have been tasked with developing SMARTY goals out of all of the work that was explained to you. So we took all of the action steps that the network had, recommended for each of the levers. And there was a lot. There was so many different things. What we noticed coming together, we met monthly for each lever team. And a lot of the action steps that were recommended by members, there was a lot of not overlap, but it was, repetitive, meaning I'm hoping that means that we're all in the right direction, we're moving in the right direction, and everybody is aligned around where we should go. So the work really came down to getting all of those ideas and then putting them into a format where everyone understands the change process and how they can be involved in making these goals come to reality. And so we've been intentionally using this SMARTY framework. So you see that SMARTY goals intentionally center two additional components, which is inclusivity. That's the extent to which a goal brings historically marginalized people into processes, activities, and decision-making. And we also want to lift up equity in everything that we do, which is the extent to which the goal includes an element of fairness or justice that seeks to address systemic injustice, inequity, or oppression, such as anti-racism. So we wanted to include, it's not just a SMART framework, it's a SMARTY framework now. So in utilizing that, we took all of the feedback, the input from network members, and we saw some overarching goals, some high-level goals that we wanted to share with you all. And so the Amplify Consumer Voices lever, they lift and center the voice and experience of those not well served by the present oral healthcare system. By engaging directly with communities, building grassroots advocacy capacity, and collaborating with other progressive movements, we can create a megaphone so that their collective voice can be heard. In the advanced oral health policy lever, the lever engages everyone in a collaborative effort to develop a shared policy agenda, which advocates for policy changes at the federal, state, and local levels. The aim is to address inequities by promoting policies that strengthen oral health coverage for all, encourages innovation and integration, and diversifies the workforce. Further down on the slide, you'll see the integrate dental and medical lever, which promotes the fact that oral health is fundamental to overall health. Open members work within our organizations, among our peers, and in concert with educational institutions, regulatory bodies, and other entities to achieve broad awareness and acceptance of this reality. We encourage pilot projects and support policies and practices to advance interprofessional care, integrate coverage and health information. In addition, we bolster everyone's learning about the importance of returning the mouth to the body in healthcare. The emphasized prevention lever acknowledges that prevention works in oral health through current payment approaches and traditional clinical practices, which favor invasive intervention over both prevention and effective non-invasive care. We know that communities without access to such basic resources as healthy food, transportation, tools for at-home oral care, and time faces challenges in maintaining good oral health. So we aim to flip these forces so that prevention becomes the norm. Care teams are oriented to an upstream approach, and better health outcomes are valued and achieved. And finally, the Bring Care to the People lever works to close the oral health gap by bringing care to the people instead of insisting that people come to the care. We listen to communities to learn what they need, then support the allocation of funding for the design and implementation of new models of care and workforce deployment. We meet consumers where they are in non-traditional and trusted settings and cultivate new messengers of help, ultimately creating healthy communities. So those are the overall aims of each of the levers specifically, and each of the levers are designed to work in concert with one another from the support of all of the lever teams, as well as open staff, and as well as all you open members that love to be on these workshops and involved in the process. So you can see those high level goals for each of the levers. And we're going to start working down from goals into objectives. And then each lever has some action steps that are in support of the objectives. So we'll be moving into that framework now. And all of this, we wanted to kind of launch this shared measurement design. We'll be, further developing a workshop series for everyone to be able to design for the impact that we hope to achieve. So we know at a very high level, this is what we're doing. We've narrowed it down to objectives and some action steps. And now it's really about setting the intention for the impact that we want to achieve. So again, very high level, this is our impact hypothesis. So the lever leads met a couple of weeks ago. We looked at each of those high level goals, and we think if we actually carry out everything there. Am I frozen? Or was that just, no, okay. You all froze for a moment and I was just terrified. But so we think that if we carry out all of these, lever goals, then oral health and overall health outcomes will improve. So kind of like one by one, if each of these levers is working in concert and we're doing everything in the plan, then we really believe that oral health and overall health outcomes will improve. So I won't read those one by one, but we're hoping beginning today, you'll start to get to know what each of these levers is about and the work that they're hoping to advance. And we'll be going through this as an iterative process once again. So it's not going to end just because we think this is the impact that we can make. Oral and overall health outcomes will improve. That's very general, right? So we're going to start to drill down and get more specific as we go along. So we're gathering information from all of our target populations. We'll be revising the hypothesis, which is at the core of our social impact, and how we analyze the work that we're going to be doing over the next 5 years. So what we have is now 3 objectives, which we're hoping to get to define some measurement goals in the coming weeks and months. But so the first objective is that open members have designed a stakeholder engagement model to connect to strategic partners, bring them to the table, maximize consumer involvement, and establish mutual goals. So each of the lever teams has a few actions for how we'll work together to advance that objective. And so once we have all the existing efforts and partners identified, we have buy-in from everybody, we'll have resources and communication streamlined, and make sure that all of our activities moving forward, they're mutually enforcing. And so we're prepared to advance this work. The second objective is that Open has designed and launched a bidirectional data portal. And this is for strategic oral health equity partners to define their own goals, right? So a lot of this blueprint is customizable. So with that in mind, we know that there's not a lot that's clearly spelled out and defined in this, but it is an adaptable plan that we want everybody to take what is going to work in their states, what is going to work in their communities. And so we'll start to weave together a picture of the collective whole that's based in this data portal. And so we want to design with everything in mind, of course, so it's a tall order. But so everyone can define their goals, understand their existing landscape, apply learnings based on all of the evidence that evidence and data that we're gathering. And so we can identify appropriate solutions over time. So what that is that open members design this comprehensive landscape analysis. So what are the actual data inputs that we're going to be talking about? So within that objective to have this data portal, we'll have many conversations about what that looks like, what should be included. And then from there, we want to make sure that we can connect skilled consultants in the states that are able to help carry out these landscape analyses, be able to provide technical assistance and support in actually inputting information and data into this massive portal. So that's going to be fun. That's in a couple of years. Don't worry, it's not starting now, but all ideas are, of course, welcome and will be collected soon. So the third objective moving down the line is for open members to be engaged in ongoing learning collaborative, and that's going to support states and communities to collaborate to achieve oral health equity in their local context. So we'll have tailored evidence-based solutions. This learning collaborative will come together to identify all the integration, prevention, access, all of those expansion models. So we're already aware of many of the policy climates in states. Many of them we're not aware. We know there's different scopes of practice. We know there's different, what you're able to bill for, what services you're actually able to perform. And so once we have that comprehensive analysis, we'll begin to learn from the outcomes in their states and then start to apply these tailored solutions. So we'll increase oral health outcomes, positive for everyone. We'll also be doing some sort of trainings, webinars, capacity building for an increased understanding of science-based prevention and systems that bring care to where people are. So we want to make sure not only are we making these changes in a policy, realm, it's also the workforce and it's also the consumers that understand what's available. So they're able to have these informed conversations and we can actually make sure that this comes to fruition in reality. And then finally, we'll see that open members in all 50 states will carry out this broad and customizable policy and advocacy strategy so that they can see these changes happening in their states and locally. So I think, Bianca, did you drop that link in the chat for the overall massive blueprint? I almost we should probably go there now just to see the big thing all at once before we go into the breakouts, perhaps. Okay. And I will pause for questions. I guess I should do that now before I get into the big thing. If anyone wants to come off mute or I haven't been eyeing the chat, but just as far as those high level goals, and now we're drilling down into the objectives before we move into the lever specific actions. Hearing no questions. Oh, sheer poetry, Vanessa, go on. Okay, so here is the overall, the blueprint as it is currently, and you see there's so many tabs at the bottom that show all of the iterations of work. But this final blueprint as of 8/25, so you'll see the levers across the top, so that's in the second row. And then the third row, you'll see the goals that are specific to each lever. The levers are in each of the columns, of course, so you'll see our color coding going down. And then these objectives here in column A, we see those were the three that I just read out loud. Each of these has lever supported action steps that are going to help us get through that objective. And then each of those objectives help us to reach our overall goal. And so while we go through the shared measurement design workshop series, we'll be able to start to drill down and say specifically, measurably, quantifiably, this is what we're trying to do. And so what is the impact that we want to make? And so starting with these objectives, we will be moving into randomized breakouts. We wanted to, of course, give people an option, but that's always limited, and for the sake of time, we're hoping any thoughts that you have will go to support both the design of the workshop series overall, our evaluation planning, and just making sure these concepts, we've been testing them out. We want to make sure that they work in reality, and what does that look like in reality? So that will be the basis of the conversations that we will be having. And let me just get this instruction slide front and center. So you're probably moving into your randomized breakouts in a minute. It looks like Bianca, her eyes are shifting back and forth. So she's very busy on her screen, getting you guys into those rooms. And so staff will be on hand to take notes for the group. We have sheets with these questions and with each of the action steps for the lever that you'll be working in. So all we ask at the start is make sure you assign someone as a reporter that will speak for the group and share what you've, just some high level takeaways from the conversation. And then as you move through all of the action steps that are in your lever in support of those objectives, just start to think about what open members, what can they do? What will they do, right? So you as an open member, what kind of actions are you going to be engaged in, and what does it look like? So it's not really what do you need? Do you need more capacity building training? It's like really like rubber is meeting the road. So what does it look like? And what would change as a result? So we're really designing with the end in mind, and we want your input to make sure that this meets your needs, this meets your interests. And so, obviously we want to make the right choice the easy choice. So what does that look like? So how can you integrate the action steps into your own scope of work? We know that everybody has a day job. Everybody probably has more than that, and kids and everything running around. So when we present this blueprint, the final evaluation plan and everything, we want to make sure that you as an open member are invested in these outcomes, and that you're willing to roll up your sleeves and do the work that we're continuing to define. And then of course, as far as tracking and measuring, they say that what gets measured gets done. So out of everything that you're going to be seeing, what actions are the most important that we want to have to share, like to tell the whole story, the impact of the blueprint. So I know those questions aren't as like succinct as possible, but that's like right after vacation brain. So I'll pause for any clarifying questions or anything that you want to add in before we jump into the breakouts. Clear as crystal. Okay, so I think Bianca, fire at will.
Okay.
And then, okay, so I see the join. So any of you that are new to RingCentral, on your screen should be the host is inviting you. And then we'll see you all back in about 40 minutes.